Good afternoon, and thank you for joining us. Since March of this year, and it's been about 4 months on this journey with coronavirus, we have been in the fight against COVID-19, and I just wanted to take a minute to thank the members of the Joint Task Force for their work. It is in times of crisis when you see someone's true character, and I'm happy to say that I've seen the best of Memphis and Shelby County and what they have to offer. What began as a City of Memphis task force then quickly became a joint task force with Shelby County government and the Shelby County Health Department. It has now grown to include all municipal mayors in Shelby County, leadership from surrounding counties, Shelby County schools, municipal school systems, independent school systems, leadership from every local hospital in Memphis and Shelby County, and multiple nonprofit organizations. I would like to thank City of Memphis Chief Operating Officer Doug McGowen for chairing these meetings and for helping navigate through these uncharted waters. You'll hear from Doug in just a moment. I'm extremely proud of the work that we've jointly accomplished. But the work of this group is unfortunately far from over. We still have so much to do if we're going to slow the spread of this virus. And we have a long ways to go before there is a widely distributed vaccine. We are, however, continuing to make progress on our mask enforcement. Yesterday, June 22nd in Memphis, we only received 3 new complaints, but we completed 46 inspections based on previous complaints. 14 of those businesses received warnings. 1 of the businesses received a summons. And then to date, for the mask compliance, we've had 458 mask complaints called into city government. The good news is 373 of those businesses came into compliance following our code enforcement officers' arrival on the scene. To date, we've had 212 violations issued by code enforcement. And the reason those numbers don't add up is because we respond to calls that were given, but we're also proactively calling on some businesses who were in violation. Only 1 business has been issued a second summons. We had an error in yesterday's report. There was no second summons issued to the South Memphis market. They came into compliance following a reinspection. Now, on a matter that we announced yesterday, over the last several months, we've worked extremely hard to do all we can to help our restaurants, many of which are locally owned. As you saw yesterday, we announced restaurants in the city of Memphis who are allowed to operate under the current Shelby County Health Directive may expand their outdoor dining space in a manner that continues to ensure public health and safety. Generally, there's 2 types of expansions available. Number 1, expanding onto their own private property adjacent to the restaurant structure, such as a parking lot. And number 2, onto publicly owned right-of-way, such as a sidewalk or a street. Now, if the expansion is on private property, the restaurants do not need to reach out to us. They can go ahead and expand. But if the expansion is onto public right-of-way, we ask you to submit your plans to Kyle Veazey at kyle.veazey@memphistn.gov. We will work with you to make sure that we process this as quickly as possible. Now, Doug McGowen.
Thank you, Mayor, and it's a pleasure to be here representing the Joint Task Force. I just wanted to talk very briefly from the Task Force perspective about testing. There's been significant conversation recently about testing, and I just wanted to address very briefly that you have seen that we are prioritizing symptomatic individuals and people who are close contacts. And unfortunately, it appears that is going to be with us for the immediate future. This is caused predominantly because of the significant uptick of demand for people who are seeking testing, but more to the point is the supply chain issues and shortfalls that we are seeing across the nation, and in fact across the world. Predominantly those laboratory pieces that are essential to conducting the test. The reagents and other pieces of laboratory equipment, the consumables that the laboratories use, are in short supply. That is causing us to have some backlogs at the laboratory and keeping them from expanding their capacity. Now, the work of the task force over the last few days, as we made this announcement, has really forestalled any loss of capacity for our local community, and that is something that has happened in other places. But we have been able to retain our basic capacity here, and that looks like it will be with us for the near future while we wait for the laboratories to actually expand capacity, catch up, and actually add some capacity so that the demand can be met for everybody who is symptomatic, people who are close contacts, and then we can begin to get to the asymptomatic for those essential folks that need to be tested. Now, Mayor Strickland talked about the work of the task force, and the testing subcommittee that is led by Dr. Haushalter and Jenny Bartlett-Prescott have done yeoman's work today managing that testing capacity. And I will tell you that the task force is looking to add to our capacity. Just as we have supported globally the expansion of the Shelby County Health Department to accept this new work, in the testing realm, we also need some new capacity. And so we as a task force are considering adding a person. I think in the press that person has been coined as a testing czar. Well, if that's the name and it sticks, then so be it. But we're looking for one person who can really manage and keep their fingers on the pulse of everything that is rapidly changing in the testing realm. No doubt you are paying attention to transformations and innovations in testing. We have gone from the basic PCR test, which was very deep in the nasal cavity, to a nasal swab, and people are actually working on a saliva test, which may be coming in the future. There are antibody tests that people are exploring to determine how those might be effective in helping us with managing our pandemic. So from the technology perspective, there's a lot to manage. From the supply chain issues, there is a significant amount of work to manage, especially as we have more than 30 labs in the state of Tennessee, and we have 6 or 7 labs that we are using here locally. So managing the demand from the hospitals, from the community clinics, from the drive-through testing sites, from employer testing, and amongst a number of labs with the supply chain issues, we really need somebody who can step forward, lean into this, and wake up every day thinking nothing but testing and how we manage those things. It would be critical in a time like this when supply chain issues are right before us and when the demand is critical. So yes, we are looking for someone who can step into the breach. Jenny Bartlett-Prescott has been doing that for the community-based testing while she is also managing a significant amount of other duties. So we're really looking for some help here. We have a couple of individuals who are interested, and we think that will really help us with our capacity to manage testing. So I wanted to address that up front. I'll turn it over to Dr. Haushalter for an update from the Health Department.
Thank you, Mayor Strickland, and thank you, Chief McGowen. A few numbers updates, and then I want to talk about some things that have been in the media over the last few days. So as of this morning, we have 17,684 cases. That's an increase of 429 since yesterday. I want everyone to keep in mind there are some delays in test reporting, so that's just the number that were reported, and it's a reflection of many days. At the current time, we're averaging around 400 new cases per day. That's still a significant number, but it has stabilized and has been fairly stable for the last week to 10 days, which is important. Our overall positivity rate for the pandemic is still less than 10%, but over the last week it's been running above 15%, which is of concern to us as well. As was noted earlier, we have really done significant work here in Shelby County. I would say it's unprecedented. Many communities don't have a joint task force, and if they do, it doesn't have the number of partners that we have locally. And while we've been able to do significant work, as was noted, we have quite a bit to do. And I also want to highlight, in addition to that work, we anticipate that information will continue to evolve and change, and we ask for the community's, one, attention to those new changes, but also a recognition that as we learn more about COVID, we will take different actions relevant to that new information. So with that said, I want to talk about two specific things that have come up recently. One is about returning to schools. There are several national documents that are guidance documents. One is produced by the Centers for Disease Control and Prevention, which is our apex organization in public health. The other is the American Academy of Pediatrics, which is the lead professional organization for pediatricians. We support both of those documents, but within the AAP document, they actually identify social distancing at a lesser amount of 3 to 6 feet. We had significant discussion in the Back to Business group, significant input from Dr. McCullers, and in part his expertise is critical because he's a pediatric infectious disease specialist, as well as Dr. Randolph and the remainder of the group. And at the current time, we, and that is the Joint Task Force, are not endorsing the 3 to 6 foot distancing for children who return to school. One, as educators, you want to plan for 6 foot distancing and masking, but for parents, when you review the plan for your school, you want to look for 6 foot distancing as the gold standard. That may be revised based on information that we expect in the fall, but at the current time, really look for 6 feet. The other is isolation and quarantine. We have talked about this from the very beginning, but there's continued to be a lot of questions, particularly in the last week, so I want to speak to both isolation and quarantine and then provide some new information just released by the CDC, and the Centers for Disease Control. I'll try not to cough. One, isolation is a very specific term that refers to people who are actually ill. So isolation is used for people who are known cases of COVID. That's a person who's tested positive or is identified as a probable case by definition. That person must remain isolated away from other people for a period of 10 days, that's 10 full days, and they have to be symptom-free for 1 day. That was previously 3 days, so now it's 1 day without medication, and then they can return to work. It's really important. So again, if someone is positive, they have to be out of the workplace and isolated at home or a hospital setting, but ideally at home, for 10 days, and then 1 day symptom-free, they can return to work. For someone who is symptomatic, unfortunately, that may take 20 or more days for them to be symptom-free before they can return to work. We do know many employers are requiring employees to be tested to return to work. There is no recommendation that an individual be tested to return to work. Once those 10-day and symptom-free for 24 hours criteria have been met, a person is able to return to work without testing. And that's really important. As was noted, we do have limited capacity in testing, and we don't want to test people unnecessarily. The other concept is quarantine, and quarantine only applies to people who are contacts but are not ill and haven't been diagnosed as a case. Those individuals must be quarantined for a full 14 days before they can go back to their regular activities, including work. So that means they can return to work on the 15th day, and they also do not have to be tested to return to work. But one of the things we know is happening, that is, employers will mandate that an employee be tested and expect them to return to work before 14 days is up. It's really critical that everyone recognize that a person cannot return to work even if they test negative. And adhering to isolation and quarantine are really critical to us reducing transmission. If anyone has questions, they're always welcome to reach out to us at Shelby TN Health, and we'll go into this in more detail. The last thing I wanted to mention is the Board of Health. There are people I know have been asking questions about the resolution that we brought in front of the Health Committee yesterday, reestablishing a Board of Health. So we just want to spend a few minutes on that, and then we'll open it up to questions. Shelby County previously had a Board of Health. It was disbanded in 1911, and the authorities of the Board of Health were then statutorily applied to the county health department. So in each county, but particularly the 6 metros, the health department has authority, the health director and the health officer have some specific authorities. But the board plays a very significant and complementary role. And as we've been in this pandemic, there's a recognition that it's time to reestablish a board. And I want to start with one of the things the board does is bring many of the assets that we have from the Joint Task Force to a permanent body. That means that there are individuals on the board who have different expertise and can shed light on issues so that we have a more informed decision as a community when we take actions during emergencies. The board would be made up of 2 physicians, 1 pharmacist, 1 dentist, 1 nurse, 1 veterinarian, and 1 citizen. In addition to providing advice to the health department, the board also has some authority to establish rules that would promote and improve the public's health. So more to come. The full commission has to vote on Monday, and if they vote in a positive way, then we'll be moving forward with appointments to that board. And I'll end there and open it up for questions.
Laura Testino, Commercial Appeal. Laura Testino, Commercial Appeal. Omer Yusuf, Daily Memphian.
Hello, can you all hear me?
Yes.
So my question is, now that I guess priorities have been put in place as far as only prioritizing symptomatic or patients with direct exposure, how do you all plan to analyze the pandemic knowing that testing capacity is full and labs are backlogged? How do you account that in the analysis of how we're doing?
It is taken into consideration, but we do know that if people who are symptomatic get tested, that's a reflection on illness in our community. And then we're also looking at hospitalizations as well, and that gives us additional information to look at transmission. I want to just point out that there have always been priorities. From the very beginning, we prioritized those who were symptomatic all the way down to asymptomatic. As we expanded capacity, we were able to open up those slots to all categories, and for the current time, we're just focusing on the higher priority categories. So we can tell what the pandemic is doing by the current testing strategy, and we'll expand again as capacity expands.
Your follow-up?
Yes, so my other question is on the positivity rate. So it seems like we're about to hit that 10% overall positivity rate pretty soon based on the current trends. How concerning is that, and what do you think needs to happen for that to go down again, like it was last month, the month before?
So what's more concerning to me is the week-to-week positivity rate and knowing that we're over 15% currently. It is remaining stable, so that's a positive sign. What we need to do is stay very laser focused on interventions that reduce transmission. And we have covered these before, but I'll highlight them for the purposes of answering your question. It's really critical that we avoid large crowds. That doesn't mean just avoiding places like bars. It also means making decisions about what you do at home, what parties you may attend, how many people you have in your household. Do you have a backyard party? Do people wear masks or not? Those things are going to be critical. Wearing masks in public is of absolute importance. But I also encourage people to think of other places that you may need to wear a mask. If you visit a family member that you don't visit regularly, you need to put a mask on because that's like being near someone in the public setting. Hand washing is critical and washing surfaces is critical. But I'm going to reinforce the importance of the workplace and the importance of staying home when one is sick and wearing masks in the workplace as well.
Dominique Dillon, Fox 13.
Hello?
Hi, we can hear you.
Okay. Well, one question is, if the Commission Board of Health is approved after Monday, how soon can we expect you guys to appoint people and they come together? And what exactly can we expect from them?
So I'm not going to give an exact date of when we would anticipate appointments. It's really important to select the right people for that board, and that will take several layers of vetting, particularly with the mayor, but also I'm sure we would ask for input from the other mayors, and we also would go in front of the county commission. So it may take a month or longer to constitute the board. What you should expect of the board is several things. One, that they provide advice to the health department. Also, generally, a health department reports to the board, so they're typically monthly meetings, and the health department is giving updates on critical issues, but they also become the voice for public health. We focus heavily in our country, it's not limited to Shelby County, on the role of hospitals and healthcare systems. But the public health system plays a critical complementary role that's a preventive role and a population level role. So we expect board members to help bridge academia and practice and clinical medicine and practice, or clinical care and practice. So they also will bring other perspective to our decision making as a health department, but they also should be advocating for public health as well.
Do you have a follow-up?
No.
Kendall Downing, WMC.
Hey everyone. My first question, and then I have a follow-up, is for Director Haushalter. I was wondering if you could explain to us, I know that the schools have submitted their plans to you all. How extensive of a review has been done on those, and have you had to send some of those back or tell districts to do things differently? And then I have a follow-up.
So yes, we've received a lot of plans. They go through a fairly intensive review. They go to the legal department first for a review relative to guidance, including those documents, but also the health directive. Then they generally come back to either me, Dr. Randolph, or Mrs. Alexander for additional review, and then we give feedback. I just want to reinforce our role is to provide technical assistance, so that if there's something that we see in the plan that could be revised to make it a safer environment, we give that feedback. We're not formally approving or disapproving plans. It really is to help that plan be as safe as possible. So we recognize this week as we were reviewing plans, that's what caused us to have the discussion around 3 to 6 feet. We recognize that some schools were using the 3 to 6 feet distancing as recommended by the AAP. And so we had to be clear that that wasn't our recommendation at the local level. However, we recognize each district may have some unique circumstances that dictates that they use the 3 to 6 distancing rather than 6. But we wanted them to know that we weren't supportive of that level of distancing.
Thank you. And then my other question is around the Board of Health. I know that restrictions at the Board of Health in the proposal that they passed could supersede local ordinances. I was interested in how you would characterize the Board of Health. Is this an attempt to try to take some of the politics out of health decisions, or kind of move it into an area that's more health focused? Thank you.
So again, a board serves several roles, and in this case, it is to some degree to remove politics, but essentially the authority of the health department is also designed to do that. But regardless of any of that, there are always political decisions that need to be made, economic decisions and social decisions. So it's not an attempt to isolate health. It's really an attempt to have more input from diverse opinions. As I noted earlier, that's one of the strengths of the Joint Task Force in Shelby County, is we have people with different expertise. And as we look at the health of the community at large, having various opinions is really critical to our ability to make a good decision overall. So I actually see them bringing perspective as the most critical component of their role. In some communities, the Board of Health does have authority to promulgate rules or regulations that improve the public's health. The example that I've used, because it's a state example, Nashville, Davidson County passed menu labeling through a Board of Health regulation. It was the only county in the United States that was able to do that long before the federal law. So that allowed Nashville to address the obesity epidemic much earlier than many other communities. So that's one of the advantages of a board, is they may be able to implement some policy sooner than state or federal level policy that would improve the public's health.
Brad Broders, Local 24.
Thanks, everyone. This question is for either Chief McGowen or Mayor Strickland. How would you just, taking a step back, how would you say how the mask ordinance enforcement is going so far? Do you have kind of a general type of business that's being cited here? And just, do you have any message to the public about the importance of calling out businesses that aren't having their customers wear masks? And I have a follow-up.
Overall, I think the enforcement's been very strong and very good, and one of the reasons is because more and more people are wearing masks. Chief McGowen texted me a couple weekends ago, maybe this past weekend, I can't remember. He went to a couple of the big hardware stores and said 99% of the people wearing it. I've noticed when I go to the grocery store, many more people are wearing it. It's becoming the norm, and that's what we want. So we're going to continue to aggressively enforce it. We'll see, as we've seen, most businesses will come into compliance once they're educated. And if not, we're going to fine them. And if it really gets to a bad situation, we'll try to get the health department involved, because they have stronger powers to shut a business. But I don't think we've come close to that yet. And I don't know if I answered all your questions.
You did. Thanks, Mayor Strickland. And just while I have you there, I don't mean to catch you off guard, but there's been a lot of talk about other cities having federal law enforcement move into the cities. Have you heard anything from the federal level about the potential of any of those agents potentially coming to the city of Memphis?
Not one word, not one rumor. I've heard nothing.
Go back to Laura Testino, Commercial Appeal.
Hey folks, can you hear me this time?
Yes.
Awesome, thanks. Both my questions are about school reopening. And first, I just wanted to ask, how is the health department approaching contact tracing within the school systems?
So contact tracing in any facility, so that would include a school, is done in a very similar way. Once the report comes to the health department, we begin our contact investigation and trace those people who are contacts. We will work closely with the schools to identify as much as we can whether transmission occurred in the school setting or the home setting, to assure that their infection prevention practices are consistent with what they had in their plan and what we've expected, and then to give education and advice as needed. There are times, if there is a cluster perhaps within a particular school or classroom, we'll work with that school to do additional testing. It's very similar to what we do in tuberculosis management. We work very closely with the schools on that. I do want to note that there's still a lot of paucity of evidence around transmission in children. So we do anticipate, as we go back to school, that we're likely to see cases in our community, and we're going to learn from that so we can share with other communities as well, and really to try to hone as much as possible our prevention strategies in the school system.
Okay, and just following up in that regard, given that kind of contact tracing is a little bit more strained these days than it has been historically, are there going to be any changes to the questions that contact tracers are asking individuals with COVID to try to identify schools, or will there be any sort of strike teams dedicated to schools in particular? Or are we going forward with the current amount of contact tracing staffing at the health department level?
So there's a couple questions here. Hopefully I'll hit on all of them. We're actually looking to continue to expand contact tracing. We're looking now of potentially having as many as 250 contact tracers, and looking at different models for onboarding individuals to assist with tracing. In public health, we oftentimes form strike teams. So we will have dedicated teams that are focused on key vulnerable populations like nursing homes, schools, corrections, and so on. But if needed, we will add to those teams. What I think is going to be important is the schools need to have one point person that they can go to that has expertise in schools, and we'll be looking to have one person that's really the main contact person, and then we'll have team members that assist with that. Your other question was about changing contact tracing. One of the things that came out in the visit from the CDC and the White House team was that we really do have to revisit contact tracing given the number of cases that we have. So in most situations for an infectious disease that's reportable, there's contact tracing for 100% of those cases. But when you begin to have significant numbers, you have to prioritize which cases are most important so that you dedicate your resources accordingly. And pediatric cases will always be a high priority, because you have to determine where that particular child contracted an illness. So we will have some slight modifications, but that's really expected nationwide. As someone noted this morning, it's how we come to coexist with COVID and do what we need to reduce transmission, knowing that there will be some transmission.
Shay Arthur, WREG.
Hi there. I know we're short. Can you hear me?
Yes.
Yes.
Hi. I know we're short on time here. Just a quick question here on the Board of Health. Are those positions going to be paid, or are they volunteer, and who's going to pay them if they are paid?
They're not paid.
Volunteer. Okay.
Yes.
And then another question. You talked about, we're seeing about 400 average cases per day, and you said that's about stabilized. That's important. What does that exactly mean? Does that mean that's our 400 cases a day is about our new normal? Does that mean we're slowing the spread, or what? How is that important?
Actually, it's to both. That we know we have transmission, but it's more at a steady rate. It's not growing exponentially like it was after Memorial Day, and that's important as we plan to move forward. We will reach a point of what is a new normal, but then there are times that new normal may adjust. And if we know it's the new normal, the interventions that we take may not be as restrictive. And if you don't mind, I want to go back to the comment around the Board of Health members. While they will be volunteer, not paid, those are appointed positions. So for individuals who are selected and appointed to serve on a Board of Health, it really is a prestigious opportunity. So I don't want to minimize it by saying it's just volunteering. It really is an appointed role that plays a significant part in focusing on improving health in Shelby County.
We are out of time. Is there any closing messages?
Just want to remind people to vote. And then secondly, we're getting very close to flu season, so I want people to begin to think about getting their vaccine and getting it earlier. We know as we get into the fall, we're going to have COVID and flu both. Thank you.
Thanks, everyone.